Hi, I'm Shannon Brinker with the Academy of Chairside Assisting, and our tip of the day is going to be talking about mirrors. There's so many different mirrors that we can use when we do our digital photography, and I want to give you some ideas of some of the ones that you can use that are very unique, and also how to take care of them, because we get a lot of assistants and dentists who ask us, what do we do to keep these mirrors clean and not have so many scratches on them? But let's go through first a variety of different types. The first mirror that most doctors really like are ones, and we know this, that have a handle simply because of the fact that we can slip the handle in and we can use either end. So if we've got the mirror, and this one is actually the medium size, you can see where it's smaller at the top, wider at the bottom to basically get the full arch form. But we can take this mirror and have the handle and just slide it in, just like that. And so I want to just kind of do that again. We can just take that little handle, slide it right in, but sometimes these mirrors will slide off of the handle. So you got to be really careful because you don't want this to fall on the floor. So what you really want to do is kind of bend this, and so I'll grab it since it's new, and this way I can lock it in a little bit better. But as you can see, it's just going to slide right in. I still sometimes find that having this makes it tough, and so sometimes I'll even try to do it at a different angle, but to me, I'm always worried, is this going to slip out of the patient's mouth? And so we know the further outside the mouth, the more stability that you have when you're taking your occlusal views. But I will tell you that I really like this mirror here. And the one that is my favorite is this one that has a rubber end to it. We get these, and we actually sell these on our website from a company called Practicon. And we love the fact that there's different sizes, and they've got different colors for the handle, but being able to have that stability is very different than worrying about the really longer handle. And again, sometimes this will slide out. The other mirror that we see a lot, that's probably one of the first ones that we were using that was really popular at one time, but now what we're finding is that it's so long that you'll see that your fingers sometimes get in the frame. Even though we know the further outside the mouth, the more control you have of the camera and the mirror, you still can see how if I had gloves on and had my fingers and holding this mirror, it would be in the frame. So I really like utilizing the one that has the rubber end from Practicon, and these are really my favorite. The last mirror that I want to mention that we also have are these, and these are really great. You'll notice the end is cut out on both sides. And why do we need that, and why is that something that's really important? If you're looking at overjet, as far as how far out those upper teeth are that sit on the lower arch, this is a great little mirror for this, because you can slip in a retractor, slide this in, and you'll be able to see exactly how far those teeth fit over the lower arch. And I'll demonstrate that here by just placing this in my own mouth so you can see, what is it that you're going to see. So you'll place it right up against the patient's teeth. Just like that. And we would actually take the camera and shoot right into the mirror to be able to see the overjet. So this is a great little mirror. And again, I like all of these. They're all really good. Good quality mirrors here, but I will tell you that, again, having that stability is really important. The last thing that I want to mention is, how do we take care of these? And when you see this, you're always going to have your fingers on it, wiping it down, spraying it down, but the way to take care of it before we place it into an autoclave or into the stratum is that I'm going to take a regular paper towel, I'm going to lay it right on the towel, and I'm just going to fold this up. Even though I see a lot of assistants will take these and wrap them in patient bibs, that's fine. We just use a regular paper towel. But you always want to do that first before you place it into your Be Sure pouch, Peel View pouch, whatever thing you're going to be using to sit it right into the envelope, close it up, and just protect this on either side. It's just another little barrier for the mirror, because these are not cheap, and we want to make sure that we're taking care of them to give them the longest lifespan we possibly can. So I'm Shannon Brinker with the Academy of Chairside Assisting, and I hope that you enjoyed the photography tip of the day.